This is Vermont Edition. I'm Michaela Lafrac. This month marks 5 years since the COVID-19 pandemic hit our collective consciousness. 5 years since lockdown orders. 5 years since hospitals filled up and people started to die at a terrifying pace. Our mannerisms changed. We wore masks, stood 6 feet apart, traded handshakes for elbow taps, and tried to convince ourselves that Zoom hangouts were a good enough stand-in for a hug. Our vocabulary changed too. Frontline workers, social distancing, mask mandates, herd immunity, contact tracing, stop the spread. Most horrifically, some of us lost loved ones. Others lost their job, their business, their senior prom. Those experiences leave lasting scars. But for many of us, the lucky ones, life has generally gone back to normal. The memories have started to fade. Remember the pandemic, we say, only half joking? Can you believe that actually happened? A new book reminds us that, yes, it happened, but it was very different for each one of us. That book is called Life Became Very Blurry, an oral history of COVID-19 in Vermont. It compiles interviews with more than 100 Vermonters, including state and municipal officials, healthcare workers, journalists, students, nursing home residents, teacher, and clergy members. It's part of a large oral history project that'll also include a podcast and an online database. We're joined today by the book's editor, Garrett Graff. He's written 9 books, including 2 previous oral histories. His 2023 book on Watergate was a finalist for the Pulitzer Prize in History, and he also hosts the award-winning history podcast, Long Shadow. He lives in Burlington now. Garrett, welcome back to the show.
Great to see you.
We're also joined today by Amanda Gustin. She's the Director of Collections and Access at the Vermont Historical Society, and she oversaw this project that we're discussing today. Amanda, welcome back.
Thanks so much for having me.
And listeners, we would love to hear from you during this conversation as well. What do you think people have forgotten about the pandemic? Call in at 800-639-2211 and tell us what you're thinking. You can also email us at vermontedition@vermontpublic.org. So, Amanda, this project started back in 2022 when the pandemic was in a much more active state than it is now. How did you know back then that this was something that the Historical Society should focus on?
Yeah, I actually knew in the spring of 2020 that this was something we would be doing for a huge variety of reasons, one of which was that we were looking for accounts of the 1918 flu pandemic because people were asking us for comparatives. I was actually on Vermont Edition that spring from my house talking about the 1918 pandemic, and we were already starting to think. We knew this was an historic event. We knew we were part of something huge, and we were already starting to think about how to document it. So in the fall of 2021, we wrote the grant, and then it took 9 months for the grant to get approved. And so we started actual work on the project in September of 2022. And I would say there's nothing complicated about it. We knew this was a massive historical event, and we knew we had to collect experiences of it.
And speaking of that 1918 pandemic, Garrett, I feel like I don't know if you had this experience. You're a historian, but when the COVID-19 pandemic hit, I feel like it was the first time for many of us to actually spend time thinking about the 1918 pandemic and learning about it. I knew next to nothing about it until this pandemic hit. I wonder if there's do you ever feel concerned that, a couple generations from now, people are going to look back and have that same lack of understanding about what happened with COVID?
I don't think you need to go several generations. I think 5 years into this, we have already largely begun to try to erase from the public memory what those early months and that period of the pandemic was like. And I think you saw through that whole, 2020 pandemic, a rush to try to get past it. And in exactly the way that we now, looking back at the 1918 version, see the trauma of that pandemic mixed with the trauma of World War I leading very much into what we now call the Roaring '20s and sort of this period of, elation and excitement in American public life that was directly a result of the shared collective trauma and mass death of the pandemic and World War I.
The pandemic was so vast. I mean, not just in its time frame, and we're still feeling its effects even today, 5 years later. But it affected our entire world and every aspect of society. Amanda, how did you and your colleagues start to perceive of parameters that you could put on this project so it didn't feel completely overwhelming? I mean, it's focused on Vermont specifically, for one.
Yeah, I will also say it never felt less than completely overwhelming. I'll be honest with you. One of the pitches we made when we applied for the grant that funded this project was that we felt like Vermont was a place where we could get to every corner geographically and sort of metaphorically, that we could do a project. We had the capacity to do a project that encompassed the entire state, and that there would be a wide diversity of experiences across the entire state of the pandemic. But even then, we knew that we would never be able to capture everything. What we knew we were doing and what we had the biggest urgency to do was capture those immediate early memories. You know, as Garrett said, people had already started to forget pieces of this. So we needed to get in as quickly as possible and talk to people as close to the event as possible to begin to capture those experiences and their memories of those experiences. We're going to be collecting COVID-19. We're going to be doing versions of this project for a long time yet. People are still doing histories of World War II, and that's coming up on 100 years ago, right? So we knew we needed to get a first pass as quickly as possible, and we tried to cast a wide net. We tried to think of sort of categories of experience that we sought out, whether those were by profession, by sort of socioeconomic status, by life experience and life circumstances, by geography. So we tried to start to brainstorm buckets and to seek people within those buckets. But then, as you said, it was such a highly personalized experience that a person might come to our attention for one reason, and then they had a whole world of other experiences that they shared with us as well.
And you worked with field historians to collect these stories. How many people did you interview?
We interviewed just over 110 people for just over 100 interviews. Some of them were doubled. Mm-hmm. And yes, the project funded the hiring of 4 field interviewers, 3 of whom ended up doing the bulk of the interviews alongside myself, and they were trained by the Vermont Folklife, who was a partner in this project from the beginning.
Mm. And Garrett, where did you come in? Were you handed like dozens and dozens and dozens of pages of transcripts and asked to make some sort of sense out of it?
That was exactly my role. Amanda, at the end of this project, when all of those field interviews were done, handed me about 900,000 words of transcripts and asked me to help edit it into the compendium that this book ended up being, that tries to I think pull out some of the major themes that we saw across those transcripts and those interviews and those experiences. And the book is organized as any good Vermont book should be into 14 chapters looking at the different 14 counties in Vermont, of course, 14th state, of course. And looking at sort of the major themes that we saw play out across those transcripts. So community and faith and family, the sort of medicine behind COVID, and then the state's response among the many topics.
Well, we've invited you throughout this hour to share maybe a particular memory from the COVID-19 pandemic that might feel unique to you and your family, or that you don't think you'll ever forget. You can do that at 800-639-2211 or by emailing vermontedition@vermontpublic.org. We got an email from KT in southern Vermont. They write, "Shortly after the world shut down, I became pregnant. This was my 4th pregnancy after 2 miscarriages and the loss of our son after preterm birth. Being pregnant again was terrifying and compounded by the fact that I had to attend early appointments, including ultrasounds, alone. It was isolating and so lonely. It's only now that I see how empowering it was as a pregnant person. I advocated strongly for the things I needed, and at 11 weeks, my partner was finally allowed to accompany me to the appointments and watch another baby growing inside me. We welcomed a healthy baby girl in early 2021. Amanda, I can imagine you heard such a range of stories from people like KT who were dealing with traumas of their own separate from the pandemic and had to navigate through those during such an unprecedented time. What was it like to kind of carry these stories with you? I imagine it must be heavy work.
Yeah, absolutely. I think that one of the things the pandemic laid bare for us was how much, as human beings, we live in community, how much we need that connection to other people in order to process difficult things in our lives or even big things in our lives, and how so many people found themselves alone, not even just metaphorically, physically, actually alone. I can speak the first anniversary of my father's death happened during lockdown, and I couldn't be with my siblings and my mother during that. So when people recounted their stories of I missed this milestone or I watched my child miss this milestone, these were emotional interviews. These were tough to do for everyone, and we knew that going in. And we tried to bring to every single interview a deep respect and a deep compassion for everyone's experiences during COVID.
And I think one of the things Amanda draws out there is everyone experienced this, right? Like part of the challenge of this pandemic was at a certain level, it was incredibly individual. It was, in ways that almost nothing in history is normally driven. It was heavily influenced by race, by your family status, by your age, by your economic status, by your work status, whether you were in an urban community or a rural community. People on the same block in Vermont did not have the same COVID experience. But almost everyone felt this isolation. One of the chapters in the book focuses on the legislature and the shift that the legislature had to make from going from working in the state house to doing all of government work by Zoom. And one of the things that I found so fascinating was the way that state officials even experienced this. The way that like the Speaker of the House is talking about, then we would end the legislature for the day and I would log off Zoom and I would be sitting by myself in my house. And there would be none of the camaraderie or the ability to sort of check in with other people about how they were doing and just, how atomizing and isolating this was for almost everyone.
And I'm glad you brought up that specific example of the Speaker of the House, a person with a specific job whose life might be hard to imagine if you were not also an elected official. I feel like many of us, could commiserate with people in our same economic or social strata, people we work with, our family members. But there's still a lack of understanding about what folks far outside our own economic or social worldviews experienced. Amanda, are there any kind of specific examples of that come to mind of somebody whose story you heard through this project and you thought, wow, I had never thought about the pandemic in this way before?
I'll start by saying I think that's one of the beautiful things about oral history.
Yeah.
Is that it allows us to connect to other people on that deeply human level, and it allows you to emotionally and personally connect to someone in their unvarnished own words about their experience. I'll be honest, I'm thinking of so many examples right now. There's almost no. I know Garrett has a really good one that he loves talking about, so I'll pass it over to him.
Yeah. I think to me, one of the things that really stood out in this project and going through these 110 or so interviews that make up this book project is those totally unexpected perspectives that really moved me. And the one that I will never forget is Eric Rossier, who is a tractor trailer driver whose job was to help deliver hay and feed to Vermont farms. And he talks about in his interview in the book the way that how during the pandemic he felt for the first and only time in his life Americans appreciated truck drivers. That he's like, on any other day, trucks are the thing that annoy you on the road. Every driver wants to be away from the trucks. And during the pandemic, for the first time, he felt that like America actually understood how vital and central truck drivers were to the American economy. And he would sort of see these signs thanking, our frontline workers like him, and he tells a story of driving through New Hampshire, and there was like a fire engine waving a flag, thanking truck drivers who were out on the road. And the first time I read it, I just like started crying, and I'm choking up, now trying to tell the story again. But like to me, that was what was just so powerful about this project, was all of these little perspectives that any normal history, high-level history of the pandemic is going to overlook because, we're focused on like the politics of the vaccine or Operation Warp Speed or, what the Trump administration or the Biden administration was doing during this month, in the Inflation Reduction Act, blah, 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 blah. And that this individual human perspective of that pandemic, I think, is what really comes through in this book.
And I want to sort of layer onto that. Sometimes when we would ask people, can we interview you? They would say, I don't know. I think my experience was kind of boring. I don't know what I would have to say. And I could honestly, and with my whole heart, say back to them, not one single interview we did for this was boring. And there was never an interview where at some point, like there wasn't this moment of just like incredible understanding, of incredible relation of experience. In every single interview, there was at least one, and often many moments where you were realizing, oh my gosh, thank you for sharing that with me. That's amazing.
Let's pause here. When we come back, I want to hear a little bit more about the people that you interviewed for this book, Amanda, and Garrett, the way that you stepped back and tried to make sense of some of these, at times, contradictory narratives. This is Vermont Edition. Stay with us. Welcome back to Vermont Edition. I'm Michaela Lafrac. Today, we are marking the 5-year anniversary of the COVID-19 pandemic and the publication of a new book of oral histories about Vermonters' experiences during that time. It's called Life Became Very Blurry, an oral history of COVID-19 in Vermont. Our guests are Amanda Gustin, who oversaw the project for the Vermont Historical Society, and Garrett Graff, a best-selling author and historian and the book's editor. What did you learn by going through the pandemic? What sticks out to you the most about that complicated time? Give us a call at 800-639-2211 or email us at vermontedition@vermontpublic.org. Let's go to the phones now. We have Michelle calling in from East Dorset. Michelle, you're on the air. Go ahead.
Yep. Hi. Thanks for taking my call.
Mm-hmm.
We were actually interviewed by Amanda down here at our house. And I think we really have one of the most unique stories that may end up in the book. My husband, who had just retired, and we had just moved back here to Vermont, at age 70, decided to start taking piano lessons. So he registered at Bennington College, which is, just a couple miles down the road. And after 2 in-person classes there with the instructor at Bennington College, the isolation, kicked in. And so they were not allowed, the classes had to go, not in person anymore. They started out in person. So he had 2 sessions in person, and then he had to go long distance. So here's the instructor who decided, okay, I'll just work out of my house. Well, okay, his house is down in Queens, New York. And, he plays in orchestras on Broadway. In Manhattan, but he lives in Queens, and he would come up here to Bennington College to teach this class in jazz piano performance. So it is true. We were fortunate in that we could afford to buy the additional technology that it took. But as you can imagine, my husband would be sitting at the piano, And because of his laptop computer, because of his iPad, and because of his phone suspended up over his hands, the instructor could see his hand on the keyboard, and he could see the instructor, on his laptop. And even today, he's still taking piano classes once a week.
Oh, that's great to hear, Michelle, that he found something that he was so passionate about during the pandemic and found a unique way to make it work. And that you have a positive memory to come out of this time. Amanda and Garrett, I wonder if you each could maybe share a story of your own, maybe a specific either memory or it could be a thing that happened, but something that when you close your eyes and you think back to, the first months of the pandemic, what was life like for you? Garrett?
So we had a young child at the time. Our daughter was just about to turn 3. And, what I just really remember was actually this immense amount of family time, which before 2020 had been traveling a lot for work and for my reporting, and was all of a sudden just home. And, I was lucky my work was able to transition very easily to remote because I was already mostly doing that. And, what I remember is just this enormous number of extra lunches and dinners with my daughter that really at that time felt sort of very special once we got over that sort of initial uncertainty of the total fear of those first couple of weeks.
And Amanda?
Excuse me. I don't have any kids of my own, but I do have a pack of small nephews, and
a pack.
Yeah, that's the appropriate word. And with 2 of them who were very young during early COVID, several nights a week we would do these FaceTime calls, and I would read books to them by showing them the pages of the illustrations in the book and talking to it. And it got so they would ask for that. And now that they're grown enough to read them on their own, we actually go back and read the same books because we were reading fairly complicated books and I was just explaining it to them. And we read them together in person, those same books again now.
Oh, that's lovely. We also got an email from Paul in Heinsberg who writes, all employees were required to sign a travel and health attestation before clocking into my work. A list of coworkers' signatures awaited me one day, and I saw a last name that's part of my wife's family tree. Surprise! My wife's 4th cousin, previously unknown to us, lives 10 miles down the road. Another email we got from Fran in Weybridge reads, what saved me during the first months of COVID was being able to work with my neighbors who started a mutual aid group. We worked with the United Way and other agencies to help support people in need. From my home, I was able to connect a nurse who had lost her childcare and couldn't get to work with a nanny for her and got some funding so that she could return to her job at the local hospital. It gave me something positive to do when things were so bleak. So this writer brings up healthcare, the nurses who are still having to go into local hospitals. And it also reminds me of just the enormous amount of unknowns that existed around what we were supposed to do to stay safe. Tomorrow on Vermont Edition, we're going to be speaking with Vermont's Health Commissioner, Dr. Mark Levine, ahead of his retirement about his role in guiding Vermonters. Garrett, what did you learn from editing this book about that time of medical uncertainty?
Yeah, I think for me, one of the things that really stood out in going through this project was just how much of the pandemic we have already forgotten. Like when you get back into it, it was, of course, not one pandemic. There were very distinct periods with specific public health goals. Many of the specifics of which I have sort of already begun to forget. The 2 weeks to stop the spread, the flatten the curve period, all open by Easter, sort of these sort of distinct moments that, we all really tuned in to the public health guidance Mike Pichek, who is interviewed for the book, who was at the Department of Financial Regulation then, is the state treasurer now. He had this travel map that his team worked on that became one of the main ways that many Vermonters sort of lived by week to week was where you could travel in New England and across the country, about whether you could come back and you had to isolate as you came back. But so much of, I think, the challenge of that time period was realizing that the medical professionals, for the most part, did not know that much more than we did as ordinary people, and that this was so uncertain. The science around it was so uncertain that, yes, there were sort of large guiding principles around epidemiology and infectious diseases that were able to come into play, but that this specific virus was unknown, and that they were really wrestling with those questions as much as anyone.
Amanda, you mentioned earlier that this work was made possible due to I think it's $137,000 grant from the Institute of Museum and Library Sciences. And the funding of that office is now being cut by the Trump administration. Just a couple weeks ago, he signed an executive order calling for the immediate defunding of the IMLS and 6 other government entities. How did those federal funding changes influence how you see your organization's future and your ability to do more work like this?
Yeah, thank you. So that order was issued on March 14th. This grant worked, and grants like it work on a reimbursement basis. So we had already done this work. We've already spent out the money for the final year of this project, which actually doesn't end until March 31st, technically speaking. But we rushed to turn around our reimbursement requests that would take us weeks to months to prepare, in the hopes that we would be reimbursed for the time and money we spent on the final year of the project. The Vermont Historical Society also has another grant from IMLS right now, in which we've hired a staff member and are working with a number of departments across our organization to teach professional skills to local history organizations. Vermont has the highest density of local history organizations and museums in the country. We have over 190.
For some reason, that doesn't surprise me.
Yeah. We win a lot of things statistically, but this one I actually really do think is meaningful, is that so much of Vermont's history is captured by these small local history organizations in each town. And that has always been part of the mission of the Vermont Historical Society, to support them. And this grant was going to take that to a new level in helping these small, largely almost exclusively volunteer-run organizations gain really crucial skills. So that grant right now, we don't have a good answer going forward. We're assuming that grant will be ended, but we haven't yet heard officially. That means we will lose that staff member and lose the next 2 years of work that was planned to be part of that. And looking even out further than that, we generally submit a project grant request to IMLS every year in the fall. And we are assuming, although we don't know anything for sure yet, that will no longer be an option for us.
Garrett, having worked so closely with the Vermont Historical Society and also, having an in-depth knowledge of the structure of the federal government from editing Politico and all of your journalistic work, what was your response when you heard about this news of these funding cuts?
So I think it is part and parcel with what we are seeing as a broad-based assault by the White House on institutions of knowledge and higher education, and that IMLS is about a $500 million a year organization, which is an enormous amount in terms of support for libraries across the country, and a literal rounding error to any other part of the federal budget. And I think it's important to make the distinction that whatever the sort of high-level public White House argument about, efficiency and, getting the federal budget under control, this is not the way to do it, and that these cuts to institutions like Museum and Library Science Institute. The Voice of America was another part of that federal executive order, as well as agencies that combat homelessness, agencies that support minority businesses, and an agency that works on labor dispute resolution. And, that's not the place that anyone would seriously start trying to cut the federal budget if they were actually serious about looking at for efficiency and effectiveness.
Well, if we need a bit of happy news about libraries, we just got an email from Linda in Halifax who writes, as a library junkie, my fondest memory of COVID was how the always resourceful librarians set up new systems to safely provide books and other materials to all of us, especially for those of us without high-speed internet or DirecTV. Being able to get movies and TV shows provided some distraction during a difficult time. Thanks to Christine and Lois at the Whitingham Free Library. We have David in Duxbury calling in. David, go ahead.
Hi. My position is that people's recollection of COVID is painted by their political views. I just had this discussion yesterday with a person who gave Trump no credit whatsoever for COVID management. She didn't recognize that Trump put in travel bans from people from countries that had a COVID outbreak, and he was called xenophobic for that move. He instituted I don't remember the name of the act, but he directed automobile companies to create ventilators, and in a very short time we had tons of ventilators. And she was given no credit for Operation Warp Speed, which got the vaccine manufactured and ready for distribution in really record time, and it was criticized as a Trump vaccine and greeted with hesitation, even though it was Trump's efforts to get it out to everybody.
All right, David, thank you for the call. And what I'm hearing in your call is that your people's political perspectives can very heavily influence how they look back on the pandemic. Garrett, would you agree with that?
Yeah, and I think that is one of the main challenges that we have seen in our collective national memory of this time period is the way that the changing politics around it have changed our memories of it. The caller talked about Operation Warp Speed and the incredible vaccine development and deployment work, which I think is one of the most significant successes of American science and American industry in the last 100 years. I mean, it is up there at the scale of the Apollo program or the Manhattan Project. And I think it has always been a strange puzzle to me that since leaving office, Donald Trump has turned against vaccines, when the caller, I think, is right to point out that the Trump vaccine was the thing that allowed us to come out the other side of the pandemic in daily life.
And Amanda, you talked earlier about finding a diversity of perspectives for this book. How did you figure out ways to include stories from people who might have different political beliefs?
Sure, absolutely. I think by thoughtfully and thoroughly explaining that our goal with this project was to capture all of the perspectives on COVID-19. So we did work with a number of folks for whom the experience of COVID-19 they felt was not the mainstream experience. I'll say that they declined to be vaccinated or had deep skepticisms about the vaccination program. They had deep skepticisms or were in some cases active against masking and isolation orders. And I would say that this shows up in a lot of interviews that people experienced. Garrett mentioned earlier that the science changed, or at least people's understanding of the science changed throughout the pandemic. And so for a lot of people for whom this was already an isolating experience, it also became an experience in which they lost faith in institutions or they lost faith in the way the world was supposed to work. And I would say that absolutely, no matter your political perspective, was a shared experience for a lot of different people, and for some people that led to change in their political perspective or a deepening of a certain political perspective as well.
And I think one of the things that stands out in that Amanda was right to grasp onto in doing this project in the first place was the Vermont experience was so unique across the country that we here in the state had leaders like Mark Levine and Mike Piechek and Phil Scott around whom the state really rallied and who we, as a state, really took seriously the public health advice. And I think in many ways, actually, the state became closer through the pandemic, which was not what happened in many parts of the rest of the country. I mean, remember, this was 2020. This was all mixed up also with the George Floyd protests in May and June and the summer of 2020. But there were armed uprisings at state capitals in places like Idaho and Oregon and Michigan. And one of the things that comes through in, dozens and scores of these interviews that the Historical Society did was how grateful people felt to be in Vermont specifically during the pandemic, where people took their community seriously, cared for their neighbors, followed the public health advice, and approached this in as nonpartisan a manner as it could be done.
Garrett Graff, you're going to stick around with us. We have to say goodbye, though, to Amanda Gustin with the Vermont Historical Society, who led the project that has now become the book Life Became Very Blurry, an oral history of COVID-19 in Vermont. There will also be a podcast and a digital archive available as well. Amanda, thank you so much for your time today.
Thank you.
This is Vermont Edition. Stay with us. Welcome back to Vermont Edition. I'm Michaela Lefrak. If you're just joining us, I'm speaking with the best-selling author, journalist, and historian Garrett Graff. He's the editor of a new book of oral histories about Vermonters' experiences during the COVID-19 pandemic called Life Became Very Blurry. He's the author of 9 books, including 2 previous oral histories, one about the D-Day invasion and the other about the 9/11 terrorist attacks. Garrett, why do you think it is important, if not necessary, to examine our pandemic experiences right now? Because we're living through this time of extreme distrust of government institutions, in the defunding of public health research. Is there any danger, I guess I would ask, in looking back on the pandemic with a critical eye?
Yeah, I think one of the things that is important in understanding the ebbs and flows of history is trying to grab memories as close to the events as they can be. As the caller earlier was talking about, we're already beginning to see our memories of COVID and the pandemic filtered through changing political lenses, changing science and public health lenses. And that, to me, one of the strengths of this project is going to be for future decades and future generations, when they look back, these memories are going to be sort of as close to original as they can be.
Oh, let's take one more call from somebody calling in with a memory of the pandemic they wanted to share. Ray in Montgomery is on the line. Ray, go ahead.
Hi. I had sort of different experience with the COVID lockdowns. Even following the state parameters, our local ski area suddenly was shut down, but the snow was still excellent. And along with some of my friends, we started skinning up at the local ski area, which was heavenly. It was sunny. It kept us sane during the COVID experience. And it gave us exercise, and the exercise was great. And I noticed there was a lot more people at the backcountry trailheads during COVID. But I want to contrast that with my wife, who was called up by the Medical Reserve Corps as a retired nurse. She took some requalification videos online, and she ended up doing vaccinations at large clinics with the Vermont National Guard. So quite a contrast with our experiences during COVID.
Yeah, thank you, Ray, for calling in and particularly for sharing the work that your wife was doing at that time. We also got an email with Joe in Thetford, who writes that one of their favorite memories from the spring of 2020 was a parade organized for local high school seniors. Like so many seniors that year, they lost their spring sports, their prom, their graduation ceremony, and so many other things that we took for granted. So a bunch of Thetford Academy parents organized a parade through the villages of Thetford. All the seniors decorated their cars and adorned them with the name of the respective graduates driving or riding in a particular car. The police and fire trucks punctuated both ends of the procession. Well, thank you to everyone who's shared memories from the pandemic with us today, both the positives and the negatives of that time. You can read more about other people's memories of that time in the book Life Became Very Blurry, an oral history of COVID-19 in Vermont. Garrett Graff, while I have you in the studio with me, we've been trying our best here on Vermont Edition to try to contextualize everything that has been going on at the federal level for Vermonters and for our listeners in this region. For you, what do you see as some of the most significant effects of the Trump administration's cuts to the federal bureaucracy in Vermont?
When we were talking about this a couple of minutes ago, I pointed out, I think, to me, this lack of connection between the cuts as they are actually taking place and the goals of effectiveness and efficiency. And I think, to me, that is the part that is most dangerous that we are living through right now, is we are not seeing a carefully considered and thoughtful exercise in trimming the federal bureaucracy, trimming regulation. We're not seeing the normal process play out between Congress and the executive branch in thinking through the right levels of staffing to accomplish the things that America expects its federal government to do. And we're just seeing these haphazard cuts, to agencies in terms of staffing, entire agencies shut down by fiat, many of which are questionably illegal or obviously illegal, firings to appointees that are, controversial from a legal perspective. And I think what worries me, as someone who has covered the federal government for 20 years now, is most of us don't understand the ways that the federal government it really is the foundation for daily life in America. From the food that we eat and the water that we drink to, aviation operations to, trade and travel, to, the basics of, commerce in the country. And what we are seeing right now is a unraveling of many of those parts of the federal government that offer the safety and security of daily life in ways that we just don't think about on a day-to-day basis. And that, one of the things that I've been talking about and writing about over the last couple of weeks is government works until it doesn't. This, we are so used to things like the air traffic control system working just on a day-to-day basis that we don't think about what will happen on the day that the air traffic control system just doesn't work anymore. The chaos that could unleash. And the cuts that we are seeing right now play out are undermining the basic effectiveness of many of those government agencies at a level that we may not feel today, we may not feel tomorrow, but there will be a moment in the coming days, weeks, or months where we deeply and catastrophically feel the cuts and disappearance of sort of core federal functions.
And you've argued that we're not experiencing a constitutional crisis right now, but a constitutional crash, something much more severe. Do you see the other two branches of the government outside of the executive acting as any sort of ballast right now?
Congress it has, I think in ways that were unanticipated by our democracy, just fully abdicated the checks and balances that they normally act upon with the executive branch. And I think that sort of one of the things that, as I sort of tried to draw this distinction, when we talk about constitutional crises in America, they're predicated upon a tension in the system. The idea that there are two branches of government in tension over something, or there's an ambiguity in the way that the Constitution allocates or assesses power, that the branches are trying to work out together. And that's, I don't think, what we are experiencing right now, that we are not seeing Congress act as it's the normal check and balance on the executive branch. We're seeing the district court and the appeals courts in the Article 3 judicial branch begin to be a check on some of Trump's actions. But I think there's a lot of reason to question whether the Supreme Court, which laid out last summer this enormous sweeping presidential immunity decision, will ultimately be a final check on this. And I think one of the things that I really worry about is the way that the founders set up our system was this very delicate balance of checks and balances, and this idea of an interlocking series of co-equal branches of government with the expectation that the other branches would be the ones who held to account abuses by any other branch. And that they did not imagine a scenario where Congress just didn't care what the president did with the federal budget, or that the Supreme Court just threw up its hands and said, look, the president can do anything that he wants and is above and beyond the law.
Do you think that the lawsuits being brought against the Trump administration by dozens of attorneys general around the country, can they be effective considering this landscape we're talking about right now?
I think one of the challenges is that we are seeing the Trump administration wreck large parts of the federal government more quickly than courts can act. USAID, the federal foreign aid agency, is effectively shut down. And whether the courts decide in the weeks or months ahead, this is not like walking back into a factory that is idle and turning on the light switches and restarting the assembly lines. USAID just doesn't exist anymore. Those people have been fired. The money is gone. Here in Burlington, we have Tetra Tech, which is a big USAID contractor, 33,000 employees, 500 offices around the world, 100 countries overseas. The company just no longer exists. Those jobs are just gone. And it's not like a federal court can order that work restarted next Monday and all of those relationships and those families and those professional careers just restart. I mean, we're seeing decades of damage done to the federal government in a matter of days and weeks right now.
Author, historian, editor, journalist, Garrett Graff, thank you so much for your time today.
It is always a pleasure to be here.
Tomorrow on Vermont Edition, one last interview with Dr. Mark Levine ahead of his retirement. He's the current commissioner of health here in Vermont. Today's show is directed by Mary Angish. Our managing producer is John Ahrens, and our producers are Andrea Lorian and Daniela Fierro. Anna Berg is our intern, and our call screener today was Kelly Delorier. Our theme music was composed by Myra Flynn. I'm Michaela Lafrac. Thank you so much for listening, and we'll catch up again soon.